9 rows activated.
From the moment the ambulance crews sign on, there is, as ever, an emergency waiting. Demand for this service is at the highest escalation level, described simply as extreme pressure. The crew know what to expect as they head in to treat their first patient. They also know that he will need to go to hospital, and that means a 10-mile drive to Bridgend. What we witness next is symptomatic of a health service unable to cope with demand.
A&E is full to the brim. Obviously there's no beds in the hospital currently. So we've had to wait outside.
Within 2 hours, there are 9 ambulances stacked up waiting. And the explanation from the hospital is bleak.
You could say it's at crisis point. You could argue it's beyond crisis point. I mean, with the ambulances outside like this, there's a strong argument that we are beyond crisis point. We simply can't get people out of the hospital. Even with the field hospital down the road, with a number of patients in it, that's not enough to cope with the current demand.
What they face here is startling and very real. The senior A&E clinician's appraisal is that this is the worst it has been throughout the entire pandemic.
Our ability to keep people safe in the department and in the hospital is really not good at the moment. This isn't safe. Certainly in terms of the quality of care we can provide, if you're on the back of an ambulance, we can get you seen, we can get you treated, we can get your investigation sent, but the quality of care is going to suffer.
Staff are tired and scared. There's no end in sight, and still the ambulances come.
So we've got 9 ambulances here and another 2 have turned up. They will face the same problem as everyone else. The hospital is fundamentally full. The patients will, of course, get treated, but the delays just don't go away.
10 hours in an ambulance is not uncommon. Swab test results are taking 40 hours or more. There is no simple answer, except a plea to the public to use A&E only when absolutely necessary.
It does get difficult, especially when we hear the control room asking for red calls to be covered. So I think it's really important for people to call an ambulance when it's an emergency.
While the First Minister said today they are coping, the situation is critical. COVID has caused a crisis, and it's not just patients facing an emergency, but the NHS itself. Rupert Evelyn, ITV News, South Wales.